Hi, I'm Craig Stout with Professor Medicare. Medicare Advantage Plans. This is the fourth video in our series. We're focused on making sense of Medicare's alphabet soup. And we do this by addressing and answering these four questions. First, when do I enroll in Medicare A and B? Second, do I stay with original Medicare A and B? What's the cost? 3, do I choose a Medicare Advantage plan? What's the cost? Or 4, do I choose a Medicare Supplement plan? And what's the cost? We've covered 2 of our 4 questions. Now, if you're just starting with this video, I suggest you go back and watch the first 3 installments. Then this one will make much more sense to you. Here's what we covered. When do I enroll in Medicare A and B? Do I stay with original Medicare A and B? What's the cost? Now it's time to look at number 3. Do I choose a Medicare Advantage plan, and what's the cost? Advantage plans are also known as Part C. They were created in 2003. People wanted more benefits than were available with original Medicare A and B, and they wanted more choices for coverage. Now, around 40% of all Medicare clients use Advantage plans. In Colorado, we have 8 different companies, and each has multiple plans. We have a chapter in our book devoted to Medicare Advantage plans. Our book, Professor Medicare's Easy Guide to Medicare, is on Amazon in either print or digital form. Advantage carriers have a contract with Medicare to manage your Parts A and B, and most manage Part D as well. Instead of original Medicare's fee-for-service system, you'll be dealing with a healthcare company who manages A and B. So put your Medicare card in a safe place, as you will be using a single card from the Advantage plan. Medicare reimburses the carrier for your membership, approximately about $900 a month for most plans. Now, here's some highlights of Advantage plans. Each plan has a network. There are HMOs, health maintenance organizations, PPOs, preferred provider organizations, PFFS, MSA, and cost plans. Many plans have 0 deductibles. Many plans have 0 premium. You can choose a plan with Part D included. Extra benefits may include dental, vision, hearing benefits, fitness memberships, and over-the-counter merchandise at no charge. All plans have a max out-of-pocket, and it must be $7,550 or less. Each plan has co-pays and co-insurance for services. The plans are very competitive and seem to get a little better, but not always, from year to year. Each year, you have 2 periods when you can change Advantage plans. First is annual enrollment from October 15th to December 7th, and the second is open enrollment from January 1st through March 31st. So you're not stuck with one plan forever. Change is possible with no health questions asked. Every September, the Advantage plans send out what's called an annual notice of change. The reason for this is that the plans are approved for 1 year, so they change every January 1st. If you don't make a change, then you'll be auto-enrolled in your current plan. So be sure to read that annual notice of change. Make sure your plan is still going to work for you. Next, I'm going to show you how to read a summary of benefits. Every plan has one. Now, you'll learn how to interpret a summary. This is a mock-up of what a real summary looks like. So take a look at it. These are very helpful in a number of ways. Summaries are a clear statement of your plan benefits. Secondly, if you're comparing plans, just look at the summaries for each plan and compare. Here are a few things to watch for. Premiums. Many, but not all, have 0 premiums. Max out-of-pocket. Medicare says it must be $7,550 or less. Deductible. And a few plans do have deductibles, but most don't. In comparing plans, you'll see that they're very competitive. They're all fighting for market share. For the extra benefits, check out dental, vision, hearing. We have one plan that has $3,000 for dental benefit. Others have from $500 to $2,000. Some have hearing aid benefits, so you want to check those as well. All plans have some kind of fitness benefit: Silver Sneakers, Renew Active, Silver and Fit. Now, when you receive an annual notice of change in September, compare the new benefits with your current plan. Summaries are one of the criteria to use in your decision-making process. And here are a few more. Providers. Since each Advantage plan has a network, you want to make sure your providers accept the plan. That's one of the first things we do with prospective enrollees. We check their providers. Medication costs can vary with each plan. I've seen big differences from plan to plan. This is important, especially if you have tier 3, 4, and 5 medications. This is another area we pay close attention to. How about travel? Do you spend months away from home each year? If so, you'll be out of network with most Medicare Advantage plans. We have a couple that have national networks, but most don't. Let's say that you're in Seattle, but your Advantage plan is for a specific Colorado area. What's that mean for your coverage? Well, if you have an emergency or need to use urgent care, you'll be covered anywhere worldwide. But let's say you want to see a dermatologist in Seattle, you'd be out of network with most HMOs, and then you'll have to pay out of pocket. With a PPO, you could see the dermatologist, but you're going to pay more. You'll pay a percentage that your plan states. In most cases, it's like 40% of the approved amount. These are a few of the main areas that we consider when we're helping you choose coverage, and there may be more. Some people are more comfortable with networks or needing referrals, but some people aren't. So you have to look at that and consider that. Others are perfectly happy with having zero premium and no deductible. Whatever your specific wants and needs are, there's a plan that will work for you. It could be a Medicare supplement, and that's what we're going to look at in our next video. Thanks.